Chiromo Hospital Group. That's where I work. But I'm also privileged to be here.
All right.
I'm married.
Yes.
Let me say that, to a man. And we are blessed. And we are blessed with 2 children.
Amen.
Yes.
That's great. Glory to God. The other Sunday was just the International Day for Suicide Awareness.
Yes,
all right.
Yes.
Let us know what's Kenya marking in this day.
I think World Suicide Prevention Day is a global event.
All right.
And it happens on the 10th of September. And it's a moment that we create awareness on matter suicide.
Yes.
Because suicide is a serious public health problem that has long-lasting impact to the individual and the family and the community at large.
All right.
So we can't hide. We can't hide and say we'll not talk about it.
Yes.
Because it's a real problem that we need now to normalize the conversation.
Yes.
And anytime we talk of suicide, mental health comes in. Matters mental health.
All right.
And as someone said, there is no health without mental health.
All right.
Yes.
Just to, first thing first, just to begin with, someone is wondering, what's suicide, just to begin with?
Now, suicide is whereby an individual takes any measure to end their life.
Okay.
That's what it means by suicide. Anything someone can do just to end their lives. We call it suicide.
Okay.
Someone can do anything, be it pill, be it, let me not mention the methods.
Yes.
But at times someone does not die by suicide. So that's what we call a suicidal attempt. Yes. So it's one thing to think about suicide.
Right.
That's what we call suicidal ideations. Then it's yet another thing to attempt suicide.
Okay.
Yes.
So the moment that it has actually happened, that's suicide.
Now, that's what we call suicidal attempt.
Okay.
Someone has attempted to die by suicide.
All right.
And that's something else I need to mention even as we talk about prevention. It's very important, stigma, a lot of stigma surrounds matter suicide. And that's why we are really creating awareness such that we don't say someone has committed suicide.
Yes.
You see, commitment, when you say someone has committed, it's a crime.
Yes.
Right.
Yeah.
So to fight this stigma, we don't say someone has committed suicide. We say someone has died by suicide.
Okay.
Yes, died by suicide. So it's a language that all of us need to change. Because nobody dies by suicide simply because they just want to die.
Right.
Because suicide is basically linked to mental health disorders.
All right.
And specifically depression and alcohol use disorder. However, suicide can also happen impulsively in moments of crisis. Something just happens and you find yourself being suicidal. Yes.
All right.
Yeah.
Probably if you could just delve a bit deeper, Dr. Rose, what would push one to that point of saying, this is it for me?
Okay. A good question, Sharon. Let me tell you a little bit about the mindset of someone who is suicidal. Someone who is suicidal, they don't want to die forever.
Oh.
But
Okay.
they just want to end the pain. They
For that season, that time.
Yes, at that time. It's not that they want to die and go forever, but it's a moment where they want to end the terrible pain that they are going through. It could be emotional, it could be psychological, but it is pain. You get it?
Yeah.
That is their mindset. And as I have already mentioned, suicide is linked to mental disorders, specifically depression and alcohol use disorder. Now, depression is a mood disorder. And some of the symptoms of depression is isolation, irritability, feeling hopeless and worthless, feeling this unexplainable guilt. There's the issue of fatigue. So there is more to suicide than just taking the medication or whatever it is. There is a mental a perspective towards the same. And there's something else you need to know about suicide. People who die by suicide, what is happening in their world? They are feeling lonely, and they feel they are a burden to you and I. You see, if you feel lonely and you are a burden to people, how will you stop being a burden? It's by going.
Yeah.
If you are feeling lonely, and remember, I'm not talking about loneliness that comes, but people are surrounding you. I'm not talking about that. It's not an issue that you're in a group of people.
Yes.
You are in your own world. You are in your own cocoon. Nobody seems to understand you. Nobody seems to get it. That's what I'm talking about, feeling lonely. And because of those two factors, someone is like, I think, to end all these, to end being a burden to somebody and feeling lonely, then they think of now suicide. Yes, to end the pain, remember.
Yeah.
Yeah.
You did mention that, it's a accumulation of feelings and, a state of the mind. So what gets us to that place of depression then?
Now, could be someone would ask, what causes mental disorders? Because depression is one of the causes, one of the mental disorders.
Yes.
Now, mental disorders can be caused by either genetics, genes, so one is predisposed. Like I know schizophrenia is has a genetic connotation. Number 2, life experiences. Life experiences, how we deal and cope with life experiences, can put you and I at the risk of developing a mental disorder. And you see, life experiences are many. Like if someone goes through bullying in a school setup, you see, it's not just about bullying. It's how does it impact you emotionally? How does it impact you psychologically? And you see, emotional and psychological well-being is not something you see. It's about the inner man. How do you feel? How do you carry the pain? You get the picture?
Yeah.
If someone is sacked from a job and you are not prepared for that, you go to work in the morning and you are given a letter. How do you deal with that? You see?
Yeah.
So it's more about the emotional and psychological well-being of people. And remember, we are emotional beings. So anything touching on our emotions is very critical. So experiences play a critical role towards the development of any mental disorder. And suicide, as I've mentioned, is linked to depression and is also linked to alcohol use disorder. Yes.
I've heard it said that, different people have different, what's the word? Should I call it tolerance or a way of being to handle, those you called life situations? Is it a true representation from where you sit as a psychologist?
You are very right, Sharon. Two people can go through the same situation, but they come out differently.
All right.
Completely. Two children can lose a parent, but they negotiate the loss and grief differently. Because at the core of each one of us is our personality. Our personality plays a key role on how we deal with experiences in life. There are people who are more emotional feelers. Let me call them melancholies. They're very sensitive. Very sensitive. So if a melancholy and a choleric go through the same thing, believe me, a choleric will sail through. Because of the way they process issues. A melancholy will be put down.
Okay.
Will be put down. A sanguine will survive through. Because sanguines, they talk a lot. So if I'm going through something, I'll just talk to somebody, and that is it. Melancholy, they don't speak. They keep to themselves. They don't discuss it with anyone. A choleric will go and speak it out. A phlegmatic will not. So our personality type plays a critical role on how we negotiate through crisis or experiences in life.
Right.
Yes.
I'm just thinking, even with our different personalities, Dr. Rose, how do we navigate these situations such that we don't find ourselves with suicidal ideations? What are the things we can do to help us cope better?
Yes. Speak to somebody. Speaking is therapeutic. Very, very therapeutic. But also remember the culture we have grown in. You speak about death. You tell someone you feel like dying. You tell someone you're thinking of. Tell me, what will those people do? You get the point?
Yeah.
The stigma that follows it.
Yes.
Right.
And that's why it's a high time, as we have the suicide prevention month. Let's normalize the conversation. Let's normalize it. Let people know it is okay to tell somebody what I'm feeling. Because you see, I'm not feeling because I have chosen, but because I'm not okay.
Yeah.
You get the picture? I'm not okay.
Yeah.
But you see, before I tell Sharon or Frank, I've been thinking about dying. I'm wondering, what will she think of me?
Yeah.
You get the picture?
Yes.
What will this person think of me? And that's why I need to normalize the conversation. And the moment you also normalize the conversation on matters mental health, on matters stress management, because you talk of depression, you can't talk about depression without talking about stress, because depression is triggered by stressful life events. How do we manage stress? That's the most important thing. But the first and foremost, can I talk to somebody about what I'm thinking, about what I'm feeling? And will the other person receive the message, or will the other person condemn me? That's where the challenge is.
Yeah.
Because suicidal ideation is a reality. Suicidal intent is a reality. And it is here with us.
Right.
But who is listening? Who is listening?
Good question. And something to ponder on even as we continue with this conversation. We're going to be taking a very quick break. But before then, Dr. Rose, this is a conversation that, many, especially in the Christian circles, would shy away from. So as a born-again Christian, loving the Lord, but also serving in this other space, we will ask you to kindly address that issue where it concerns, believers.
Yes.
Yeah. So let's take a very quick break, but we'll be back in just a few moments. Stay with us.
Okay.
Breakfast Table on Activate. Listen and leave.
Right, just before that was Nairobi Lighthouse with that beautiful song playing on Hope FM. Listen and live. Thank you for staying with us. We continue with this conversation on suicide prevention, and we encourage you to send in that question that you could be having. We already have one that we'll be having a look that was sent a bit earlier, so send in those questions. Ask as many as you possibly can. Let us get some help. And well, before we get back to the conversation, Dr. Rose, someone is saying congratulations, Dr. Rose, for the good work you're doing at CHG. God bless you. This is Josephat Mothoka, Chiromo Security Supervisor. Wow. Thank you, sir, for listening, and God bless you. All right. So just before we went for the break, we were saying this is a conversation that, Christians would shy away from. Frank, tunasema aje?
Yes, it is well.
It is well.
Yeah.
It is well with my soul.
Yeah, we trust in the Lord.
Yeah. Kuna viso vitu. What would you say, Daktari?
I think, Sharon, there is need for the church to arise and address matters mental health. You see, in the Bible, at some point, David said, "Why are you so downcast, O my soul? Why are you disquieted within me?" That was a cry for distress. And don't forget, David was a man after God's own heart.
Right.
If David would have low moments and acknowledge them, who are we? Who are we? And the Bible says we'll face tribulations in this life. And as much as we trust God, and God is indeed our refuge and our fortress, but God has given us resources. Let me ask you, if someone develops or gets cancer, do they go to seek help?
Yes.
They do.
Yeah.
They trust God, but they seek help.
Right.
So if I am being suicidal, which could be a sign of a mental disorder, why not talk to somebody? Let's normalize the conversation. Because we are dying, and yet God has given us the resources. Because I'm a strong believer, all knowledge is God's knowledge. The knowledge that psychiatrists and psychologists and doctors have, it's not their knowledge. It's God's knowledge.
Yes.
And it's for all of us as Christians. And the fact that I'm thinking of dying, it does not make me not being born again. Is it Elijah or Elijah who at some point asked God to kill him?
Yeah. It's Elijah.
He was actually suicidal.
Yeah.
That's a suicidal ideation. Suicidal ideation is when you think thoughts of dying cross your mind.
Yeah.
But look at the context. In which context did he say this? It's after Jezebel threatened him. Are we threatened in life? Yes, we get threatened. Don't you forget he had just had a victory.
He did.
After victory, he is threatened.
Yes.
Someone would wonder, then where is this victory not carrying him through? And the answer is, he's a human being. Even if God uses you miraculously and things happen, that does not mean you are immune to challenges in this life. We're in this world. We are not of this world, but here we are. I'll be hurt. That's the truth. I'll go through a traumatic experience. And I will pray and I will trust God. At the same time, God has given me resources. People that I can go talk to. And you see, it still goes back to stigma. Leave alone suicide. Matters mental health. How many people, how many Christians, for sure they have symptoms of depression, but they tell you there's an attack from the enemy. It can be an attack, that is true. But is it possible you seek necessary help? Just the same way someone gets cancer. You'll go to the pastor, they pray for you, and we trust God. But at the same time, you go to see the doctor.
Right.
You get it? So I think we need to change our perspective about matters of mental health in a church setup.
Right.
We are all human beings, and we go through the same challenges in life.
Okay.
Yes.
Now, talking about the issue of church, there is how the society is wired to think that men don't need to open up about their challenges.
Yes.
Would you please address this?
It's unfortunate, Frank.
Yes.
We've been socialized that boys, you don't cry. And you know the primary socializing agent. Do you know who is the primary socializing agent? It's the family. mothers and fathers.
Yes.
How do we treat our children?
Yeah.
The boy is hurt. You're not supposed to cry like your sister.
Yeah.
You see, we start now putting that mindset
Yes.
in the little boy.
Akwe mwanaume.
Mwanaume ni kuvumilia. You get it? And don't you forget, this same man is a human being. He has his own feelings. He has his own frustrations. But he's been socialized. It is now ingrained in his mindset that I'm not supposed to speak. I'm not supposed to shed a tear. And that's why, because that is not possible, more often than not, men will look for other ways to cope with what they are going through. For a woman, she will go to Chama, talk, and she's good to go.
Yes.
Or she will call her girlfriend. Or she will cry until she has nothing more to cry. And then after that, there's a sigh of relief. But for a man,
Yeah.
our society has actually created this perspective, this mindset. And this is what I tell men.
Yes.
Because the society needs to change, as we wait for the society to change, I advise men, look for a safe place, a safe space where you can express yourself.
Would
It
you?
could be in another man. Get it?
Yes.
I know there are men who have their own camp, let me call it camp,
Yes.
where they're just being themselves.
The caves.
The caves. They go, they share amongst themselves. Let them be real with each other. Because at some point, there is a much you can carry, Frank.
Yes.
There's the much you can carry. And that's why, globally, it's been known that more women attempt suicide, but more men die by suicide.
I see.
Die by suicide. Let's normalize the conversation. To all men listening to me, look for a space, a safe space, a place where your masculinity, your ego will not be threatened,
Yes.
and speak about what you are going through. Let you be sorted out, because you are a human being. At the core of who God created you is the emotional person.
Yes.
Someone who is hurt, someone who is frustrated, someone who is discouraged, someone who feels overwhelmed. At the core of you, God put that. And it will only be fair for you to be aware of yourself.
Right.
Yes.
Dr. I'm just thinking about now this being a family conversation, how the ideation and the attempt and everything affects a family setup. What would you say to that?
Let me tell you, suicide attempts or suicide in itself affects the family and the community. More often than not, when someone dies, when you go visiting, you're like, what happened to the person? The person had cancer. It was a road accident. But when it comes to suicide, nobody wants to talk about it. Because it is a disgrace. It's like, how could you?
They'll find something else to cover up.
Yes. So people don't say the cause. In fact, I'm told in some communities, if someone dies by suicide, people don't mourn. You are buried the same day.
And you're beaten.
Because it's a taboo.
You're even beaten.
Yes,
Yeah.
it's a taboo.
Oh, wow.
You get it?
Yeah.
So it impacts the family. And how does it impact the family? The greatest part is when you start asking yourself, why didn't I see the red flags? Why didn't I do this? I wish. You get the picture?
Yes.
The guilt that comes with it.
Right.
And more so if it happens at home, the trauma that comes with it. So it impacts the family so much. And in fact, if it is not well taken care of, it can lead to more suicide attempts.
Right.
Right.
Because
Because
within the family.
yes, it crushes the spirit of the person
Right.
or the people.
Okay.
Yes.
All right, just hold it right there. Let's take the latest in the business world with George, and then we'll be back in a few to continue the conversation, just to learn about now how do we prevent,
Yes.
and also to answer some of your questions. Please don't Continue with our conversation today on suicide prevention, and we have with us Dr. Rose, as we, she helps us to know how to prevent. Now, Dr. Rose, before we go to the prevention, there's one question that we received earlier on, a listener saying, okay, getting to it in a short while. Here we are. I am 22 years. I've gone through a lot ever since I confessed Christ as my personal savior. Dropped out of school and worked, and then gone back again, then dropped out again. Currently, I'm a candidate. My situation this day is forcing me to think of taking my life, but I just can't do it. I'm stranded. Please help. My problems are not physical. They are psychological and emotional.
I really appreciate that the person has written. Please take note of something he has said. His problem is not physical, psychological, and emotional. That which you and I can see.
Yeah.
You get it?
Yeah.
My advice to this person, please seek counseling. Because counseling is an environment where you are given the opportunity to be you. In a non-judgmental environment, where you express everything, then you are helped to tap into your inner strength. You are helped to negotiate through what you are going through. Something else to take note about what he has said, I have gone through so much. You remember I said one of the risk factors to mental disorders is experience. He has just said it. I have gone through so much. So he is psychologically and emotionally drained. The answer is seek counseling services completely.
Right.
And we don't seek counseling because we have run out of our minds. No. There are moments I'll seek counseling. To be sincere, I'm a clinical psychologist.
Oh, okay.
There are moments I'll seek counseling because I'm human.
Yeah.
And there are times you feel overwhelmed. And you only need to talk to somebody who will listen to you and give you an opportunity to be you and help you negotiate what you are going through. Help you to have a different perspective to what you are going through. Helps you to see your inner strength. Helps you see that which you can't see. That's what counseling is all about. Yeah.
Right.
Yeah.
Okay, and we have counselors at CTAM. Counseling is free of charge. Please pick this number, 0709 861 240. You can either call or send them a message on WhatsApp. They will reach out to you. 0709 861 240. All right, let's go to the prevention. What do we
Yes.
do to prevent?
Okay. Now, thinking through, learn how you can help. How can you be helped? How can you help somebody? Because suicide prevention saves lives. But you see, someone is asking, how do I prevent?
Yeah.
Yes.
Now, for you to prevent, you need to know, number one, three things. Number one, you need to know something called risk factors. These are factors that can put someone at a risk. I mean, some factors that can make one think of dying by suicide. Factor, there are many.
Yes.
Breakup, divorce, traumatic experience, previous suicide attempts. Number two, you need to know warning signs. What is this that I when I see? It's a red flag.
Yes.
And number three, you need to know something called protective factors. Those are three key factors you need to be aware of. And one of the protective factors that is so key is network, support. Is this one person you can call and you be yourself? That's what we call support. And it's very important. Now, how do I help? I want to use an acronym LEARN.
LAN.
Yes, LEARN. Now you'll be students.
Okay.
Yeah.
With pens and papers.
Pens and papers. The normal LEARN.
Okay.
LEARN. Yes.
Okay.
So I want you the acronym LEARN how you can help. L stands for look for signs.
Signs.
Okay.
A stands for empathize and listen.
Okay.
I will expound a little bit. The other one is what? A.
A.
Ask about suicide.
Okay.
Then after A is R. Reduce danger.
Okay.
And N. Next step.
Next step. All right.
Yes. So we are together up to that point.
Yes.
Yeah.
look for signs. Which signs are these? These signs can be in form of emotions, they can be form of behavior, they can be in form of experiences. Emotions like feeling hopeless, helpless, worthless, irritability, someone who is going through depression per se, right? That's very key. Look for such signs. Anything that is out of the normal as far as the person is concerned. And not just for 1 day or 2 days, at least for 2 weeks. There is something emotionally, as far as feelings are concerned, you can tell there's a difference in that person. Some people always say, I feel like I want out. I just want out.
Yeah.
You get the picture? Now, that is as far as feelings are concerned. Behavior. When people start giving out their precious gifts, that could be a red flag. In the context that they are going through something.
Right. Yeah.
Remember, it's not out of context.
Yeah.
Yes.
No.
Yeah.
There's the context of an experience. When someone starts giving out their precious things, when some people start talking about, I'm better off dead than alive. When people say, I feel trapped. When someone asks, if I died today, who will cry? I mean, there is a conversation, there is someone is preoccupied with death.
Okay.
That's a red flag. Then it's important to look at the experiences that person is going through. As they say all these, and their feelings are all the way they are, what is happening in their lives? Very critical. Very critical. If someone's going through a hard experience, like divorce, like sexual, emotional abuse, has someone lost a job? Yeah? Has a child been bullied in school? You know, gone are the days when you tell a child, hata wende uchapane.
Yeah.
No. My friend, it's traumatizing. It's traumatizing. But who is listening?
Right.
Who is listening? And there are moments children, let me now talk about children. Children will not say what they are going through because they're already threatened. They won't say. But our eyes open to see there's a change in a child. You get it?
Yeah.
So we have to listen to what they are saying. We have to observe anything that has changed. And we have to understand in what context. So that's what we look for the signs. Then when it comes to empathize and listen, I think we need to learn more about empathy. We need to listen to other people and empathize. Empathy is about taking the position of as if I'm the one who's going through that. How would I feel? So if I can put myself in that person's shoes, I'll be very careful what I say. Because I can feel with them.
Yes.
You get the picture?
Yeah.
But unfortunately, we are not very good at listening. What we call active listening. Someone is talking and I'm busy trying to get an answer for you. There are moments you don't need an answer. You just want to talk.
Yes.
You just want to be heard. You just want someone to understand you. Whether it makes sense or not, you are seeking an understanding. And that's what we need to do. So if you realize someone has changed, let's create time. You don't know what is in their world. Listen. Keep reminding your head, I'm not talking, I'm listening. We call it active listening.
All right.
Then the other one is ask about suicide. Now, there's always a fear. People always say, if I ask somebody, how do I ask somebody? Do you want to kill yourself? You know, so people will say, won't I be introducing death into their mind?
Yeah.
The answer is no. Given the context, remember, it should be within the context that I have already mentioned.
Yes.
So what you do, you don't ask somebody, you should be direct. Now, this is tough, especially for those who are not psychologists. It's good to be, you don't say someone, I hope you are not planning to do something nasty. You know, that's just being vague.
Yeah.
You get the picture. And yet in your mind, you know what you mean.
Yeah.
So the best thing is to ask the person, but be wise. You get the picture? For instance, I realize so-and-so has isolated herself. She's going through a divorce. She's irritable. And I am concerned because there are telltale signs. She could be thinking, what do I do? I will approach her from a broader perspective. And I say, when someone is going through challenges in life, they might find themselves isolating. They might find themselves feeling hopeless. You bring all the signs you have seen. But remember I said someone. So it's not you. So you get it. And during such times, people might think about suicide. See, now I'm normalizing the conversation. I am inviting the person to have a conversation. And the person is feeling, so people feel what I'm feeling. So people think the way I am thinking.
Right.
You get it? People are thinking about suicide. Then you ask, could you be thinking about suicide? You see, they have asked. In a very welcoming way. The person can either say yes or no. The question is this. If they say yes, what do you do? Number one, take them seriously. Take them seriously.
Sio waongezwe kamba.
Hapana. Si wakati sisi tulikuwa when we were younger, a parent would tell you take this. No. Take them seriously. They might not look like it, but they have said it. Take them seriously. Number two, appreciate them for being honest. Right? What if they say no, but you have all reasons to think they are cheating? What do you do? Just let them know you care for them.
All right.
Communicate care. Communicate understanding. And then what you can do, because you still want to support, you can ask that person, if by any chance you ever found yourself thinking about suicide, who can you talk to? You know what you're evaluating? Their support system.
All right.
You're evaluating their support system. Then someone tells you.
Dr. Rose, sorry, I want to cut you short.
Yes.
Because apparently our time is gone. We just are about to get to 9 o'clock. I don't know how you will help us wrap this up. In a sentence or two. Sorry, I cut you short.
It's okay.
But at least you had already outlined the LAN.
Yes.
How do we wrap this up?
Now, mine, what I will say is that suicide prevention can save lives. Please talk to somebody.
Right.
Just talk to somebody.
Okay.
And you'll get the necessary help.
Thank you.
Yes, there's hope.
There is a lot of hope indeed. Thank you so much and for coming, and thank you for